To become a doctor, you don't just take a written exam. You take an OSCE, Objective Structured Clinical Examination. Think of it as a high-stakes acting exam where medical students are given 10 minutes to diagnose a fake patient while the examiner watches their every move. Imagine if you forget to wash your hands, miss a symptom, you fail. Currently, the only way to practice OSCE is through physical friends or physical partners.
The reality is medical students want to practice together, but schedules don't align, and burnout is real. So students are left preparing alone, trying to make it work with notes, textbooks, and whatever they can find for an exam that is built around conversations. In a recent study, 70% of the students identified the OSCE as intimidating, and this has been reported in other studies. Approximately half of the students identified the OSCE as being more difficult than other forms of assessment instruments such as MCQ, essay, and clerkship rating.
To ensure our solution drives real-world impact, OSCE Partner was built with the Sustainable Development Goals at its core. Specifically, we designed our platform to champion SDG Goal 3, which increase health financing and support health workforce in developing countries under SDG Goal 3, good health and well-being. This target focuses on increasing the recruitment, development, training, and retention of the health workforce in developing countries. OSCE is not just a one-off final exam. It is a constant examination throughout every semester of the 5 years of medical study. We hope to ease the mental burden of students, which indirectly reduces the number of medical dropouts. This helps in the retention of the health workforce.
And that is exactly why we built OSCE Partner. To be medical students' OSCE partners, available anytime, 24/7, accessible anywhere, and here is how it works. Getting started is simple. Log in, generate a case, begin. You're presented with an OSCE-style scenario, the question and patient details. When you're ready, start the encounter. A live 10 minutes timer will start automatically, a reminder at 8 minutes, and a buzz at 10, just like the real exam.
Hi, my name is Ming Yin and I'm a second-year medical student. Can I check your name and IC number?
Tan Ah Kok, 701021101991.
How would you like me to address you?
Just call me Ah Kok.
To examine the patient, simply click Physical Exam. Then, use your hands to indicate the site of pain. Your
Hello,
movements
Mr.
are
Pain
tracked
here.
in real time, making the physical exam interactive and intuitive.
Center of your chest. Here.
Yes, that's exactly where it hurts. A lot.
How does it feel when I press?
It's sharp, like pressure.
Okay, I understand.
Once the history and exam are complete, it's time for the Viva. To start the Viva, just start speaking.
Hello, please start the Viva session.
Hello, what is your immediate priority in managing this patient?
He would perform an ECG scan and prescribe some painkillers.
While an ECG and pain relief are important, what is the very first clinical step in a structured approach?
When the session ends, you get detailed feedback and a full answer review. Cases you struggled with are saved, and our spaced repetition system automatically brings them back at the right intervals so your practice keeps improving.
Now let's talk about how it actually works and how student feedback shape it. We visited International Medical University to gather feedback from preclinical students and continuously refine our prototype based on their input. On the front end, we built a website interface using React and Tailwind CSS through Google AI Studio. When a student speaks, the Web Audio API converts microphone input into raw PCM audio, which is sent to the Gemini Live API to generate real-time responses from the AI patient or examiner. During the physical exam, camera input is processed through MediaPipe to detect canned key points. Gesture data is sent to Gemini Live, allowing the patients to respond dynamically when examined. The image of the patient's body is generated by Gemini Image API. After the whole session, Gemini 3 Pro generates the feedback and answers for the website. For the back end, we use Firebase authentication for user authentication. Cloud Firestore is used for storing information and history of questions attempted. We took in user feedback to include an option for users to type if it's not convenient to speak in noisy environments.
We are currently focusing on cardiology, but our solution is built to scale into other medical specialty.
We are GoogleGaga and we are helping preclinical medical students ace their OSCE.